I want to go ahead and welcome our panelists, and I will start with Dr. Lader, and then we'll go to Lindsay, Hillary, and Allison. And if you want to share your name, your position, and how long you've worked at Dayton Children's. So, Dr. Lader.
Sure. I definitely want to start by saying that it is scary being up here right now. Not because I'm afraid of an audience, but because everyone here listening feels really passionate about this topic. Heck, who doesn't feel passionate about what's been going on here lately? So I'm Mary Lader. I'm one of the hospitalists here at Dayton Children, and I'm a mother to 3 young children. Many of you here know them and have seen them grow up. I guess I'll pause and let everybody introduce themselves. Does that make sense, Kristen?
Yep, go right ahead. So, Lindsay.
I'm Lindsay. I'm a nurse practitioner in the emergency department. I started at Dayton Children's as a new graduate nurse in 2006. I became a nurse practitioner and took about an 8-year hiatus in Columbus, and then came back here about 5 years ago. We moved back to the Dayton area. I have a husband, Paul, and we're high school sweethearts, and I now have 4 children, 3 boys, 7, 5, 2, and a little 4-month-old girl who is definitively our unplanned blessing, or as we lovingly call her, our COVID baby.
Thank you. Hillary?
Hi, my name is Hillary O'Neill. I am a respiratory therapist and the specialty peds manager for our respiratory department here at Dayton Children's. I have been at Dayton Children's for a little over 6 years now, which seems crazy. It flies by. I am married. My husband and I do not have any children yet, but we are hoping to in the future.
Thank you. Allison?
Hello, everyone. My name is Allison. I am the assistant nurse manager currently in behavioral health. I have been at Dayton Children's for 10 years. I started out as a new graduate nurse extern back in 2011. And I started as a nurse on 3 West and 8 specialty pediatrics, and now have transitioned over to behavioral health. I have a 6-year-old daughter. I am a single mom and happy to be so. She is thriving, healthy, positive young female that's in the make, so that's a good thing, and we're excited to be here with you guys.
Okay, thank you. So first, I want to open up to, and I'll start with Dr. Lader. Each one of you made the decision to receive the COVID vaccine. Talk about what led you to this decision, kind of your why. Why did you want to do this? What maybe either research, or who did you speak with, or if you had to work through anything, share really your why. We'll start with Dr. Lader.
Okay. Well, thanks, Kristen. You know, I started off saying how passionately everybody feels about this. I feel passionately about this too. You know, those who are vaccinated feel very strongly that this is the right choice. And of course, those hesitant, or even those who downright refuse to get the vaccine, believe very strongly that this is the right choice for them and their family. And the crazy thing is, I'm not convinced that anybody's wrong. There's a lot of smart people here, and we've all come to our decisions not lightly. We've thoroughly thought this through, right? We've all read and listened and gathered both data and opinions, mulling it all over. We're educated, and we're still not falling on the same side of this. And the reason that we're not on the same side of this is because each of us has to make our own risk-benefit calculation, right? At the end of the day, it's all about that math. What's it going to cost me versus what is it going to give me? And this calculation is really hard. It was hard for me. It was scary for me, and it took me a while. You know, sort of as a side note, and nobody asked me to say this, but really even the hospital as a system had to make this exact calculation. I mean, not like me, where I had to just think about myself as an individual. They had to think about the entire institution, the at-risk employees, the vulnerable patients, and honestly, the entire region that we serve. But through this exact same calculation of what's it going to cost versus what is it going to bring, they landed on the vaccine mandate. Now, I wasn't at that table discussion, but I can see how they came to that conclusion. So, you know, right now, each of us has to make this decision for our own calculation. Each of us has to decide for ourselves what the risk benefit is. Now, true, the hospital did add employment in the risk column, but they didn't make this calculation for us, right? They didn't make the calculation for me. I still had to decide for myself what I was going to do. And the reason that I chose to vaccinate is because I have a husband with chronic illness. I am high risk for contracting this really infectious disease, right, through my career. I have very young children who need me. And to be honest with you, going through all of the data and all of the science and all of the research, it just looked like for me, this made the most sense. I didn't want to find out if my husband was going to be one of those who, wasn't going to recover should he contract this disease. Also, I don't think my family's complete. And I wanted the best fighting chance at a healthy full-term pregnancy should my family become blessed with another one. And the risk of early and even late miscarriage is exceptionally high when you contract this virus, while on the flip side, studies have shown that the vaccine has no negative effect on fertility. So in my own calculation, that, it wasn't worth a theoretical cost of getting the vaccine versus actually contracting it. So I'm vaccinated for that reason. But, again, that's the reason for this panel right now. The reason we were assembled here was not so much for you to replicate my math or any of our calculations. The intention was maybe by hearing some of our thought process, you guys can use and mold this to formulate your own process. Because here's the thing, and then I promise I'll be done after this. Just like with every other mathematical equation, if you plug in different numbers, you ultimately get different results. And that's where the articles and the statistics and the studies and the graphs and all of that hardcore science really comes into play. Making sure that you plug in the correct information. There's so much misinformation out there, and it's really hard to know what's real and what's skewed or outdated or even simply doesn't reflect on your situation at all. Collectively, we have access to so many reliable sources, some of which, as a panel, we're going to go through here with you today. But please just make sure that when you're going through this calculation, fear and emotion and politics, that they don't have a seat at the table. They don't belong in your equation. They popped up, but when it came time to making my own decision, I had to put them aside. And I did conclude the vaccine made sense for me and for my family. Okay, I'm going to stop.
Thanks, Dr. Lader. So I appreciate certainly your thoughts very much. Lindsay, you received the vaccine when you were actually pregnant. So share with us how you, again, why you made this decision. What's kind of your why?
Sure. So I would describe my decision to vaccinate as definitely more of a journey. I think at the beginning of this pandemic, when I realized, okay, this is the real deal, I felt like there were probably three ways out of this. First, that it was going to magically disappear. Hasn't happened yet. Second, that enough of the population, the majority of the population, would get this horrible illness in a quick enough time before it mutated, reinfected, and I didn't want to see what that would yield. Or third, vaccination. But honestly, at the beginning of this, I thought, this is going to be years, because how on earth would it come up so quick and be able to be developed and produced and get all of the studies done? But then as everybody kind of started hearing about the mRNA technology and how it has been used for years very safely, and we essentially just kind of have to program it for the correct virus, that was pretty exciting. But I wasn't one that was ready to jump into a study. I wanted to kind of take a step back, wait for those study results to come out. And in the summer, our COVID numbers were pretty low last summer. So I was a bit more comfortable of kind of let's watch, wait and see. And then in the late summer, we found out I was expecting, and I knew that was definitely going to have a seat at our table as far as whether I got vaccinated or not. Again, in the late summer, we still weren't having a ton of COVID. So it was pretty, let's watch and wait. Then in the fall, and honestly, I also thought that I probably wouldn't even be able to get vaccinated because I knew that they weren't including pregnant women in those initial studies. So I kind of almost thought, I'll just wait and see what happens. Then in the fall, it started getting worse, as we all know around here, and that was pretty concerning to me, especially because of where I work. I knew I was going to come into contact with patients who were actively infected, and being pregnant, I knew that I was at really high risk to get really sick, be on a vent, or potentially die, and that was, or even give it to my fetus. And there was so much unknown about how it would affect me, how it would affect the baby, and that was really scary to me. I think that in the late fall, maybe very early winter, ACOG came out with their position statement at the time saying, it looks like the theoretical benefits are probably outweigh the risk, and go ahead and talk to your OBGYN. And once that position statement came out and I had learned that, there were women in those studies who were pregnant unknowingly and they're doing well, then I thought, okay, I need to really go to work on this and give it thought, really research it. So I started reading a ton. As we all know, Dayton Children's did a great job and provided that panel with doctors Alter and Mezoff, and that gave me a ton of information. I have a huge support network in my life, and I have some wonderful experts in the field. A friend of mine in particular who just she's an OB/GYN and finished her fellowship in fertility. She herself was pregnant and she was getting vaccinated, and she really walked me through the research and the technology and why the technology would have no theoretical risk to me or the baby, and what they were seeing with COVID in pregnant women and how concerning it was. So after a lot of reading, a lot of thought, a lot of prayer, and a lot of discussions with my husband, who's not medical, but wanted him to have a input as well, I remember a discussion where he said, okay, Lindsay, so we know that we haven't had any evidence to suggest this vaccine is going to hurt you being pregnant, but we know that you could get really sick if you get infected. You can't leave me with 3, possibly 4 children. And so I think after that discussion, it really kind of made us come to the conclusion to get vaccinated.
Awesome. Thank you for sharing, Lindsay. Hillary, what was your why? Share your why with the group.
So my why was definitely, I think, even more related to my family than my own personal health. I mean, in the beginning, everyone was saying, younger, healthy people, that COVID wasn't a huge risk to you. And, but I was, looking at that, but I had to also look at the people around me and the people I work with. And, there are lots of people in my life who are either immunocompromised or have medical conditions that I don't know that I could live with myself if I knew that I was putting them at risk too. If I knew there was something that I could do that, is going to protect me too, but it's also going to keep my family safe. It's going to keep my loved ones safe if I know that I'm not helping put them in danger too. So, that included masking and keeping our distance, especially when that was appropriate. But I also kind of looked, for my own personal risk or concern of getting vaccinated, when they came out with the vaccine that was really new, my first thought was wow, this seems really sudden. And so my first thought was, well, what am I afraid of? What seems scary to me about this, and what information exists that I can get some answers to what's scaring me. And I think that's kind of how I've approached the whole situation, especially when the fertility questions came up. That's a scary thing. I think that scares any woman who has any thought of having children in the future. Even if you don't, even if you think right now, maybe I don't want kids, but you think maybe I will someday, that question of, is it going to impact my fertility, is very scary. And so hearing that, my first thought was, well, let's go to sources you can trust. So I looked up peer-reviewed articles, because that's, what I've always been taught to do from a research standpoint. Anybody can put out information, but if you go to, you do research and look for articles that are peer-reviewed, that are verified, that are put out by sources that have the right information. And once I found that information, and it, was and is still pointing to the fact that the vaccine is safe and it's not causing any of these issues that people are talking about, I think that made me feel a lot better. So just getting the information that was available from sources that I knew were reputable and knew that I could trust was definitely important for me.
Great. Thank you for that, Hillary. Let's move on to Allison. Allison, your why. Share the why with the group. Allison, you're on mute, sweetie. Unmute yourself.
Thank you kindly. Appreciate it. Sorry, guys. So my why, pretty much, I have mixed emotions in regards to kind of from a hospital in addition to my own personal life. And really the initial fear was, this is a new vaccine. Do we really know, what's involved in it? What what is the risk to me? Is it a risk factor that it may prevent me from going home to my daughter every day? So that was something that was a concern for me, just because, looking at it from a single mom standpoint, she relies on me. She counts on me for everything. But I also had to use my critical judgment and my thinking in terms of where I worked. And I was on 3 West, I was on the infectious disease floor. I knew that we were going to board those kids. And so really just looking at what was the risk factor that I was posing to her and what really was getting in my way. I think sometimes is really, you got to take the opportunity to understand what is the fear, what is the anxiety, where is it coming from? And I think once you pinpoint that, sometimes you have to shut out the noise. And politics, personal viewpoints, discussions, biases can really crowd your judgment and really not make you make sound decisions. And so I think it's important to really minimize all of that, really identify what is the reason that I'm so afraid, and do I have the right information? And if I don't, who can I talk to? A great thing about working at Dayton Children's, and one thing that I have loved about my entire career here is I have physicians here that I trust. I have nurses that I trust. If I have a concern or a question, I know how to find the answers. One thing that we pride ourselves on as clinicians is that we are able to help our parents make those informed decisions. So how do we help support that in our own life, and how do we foster that? Well, it's all about just making sure you really identify what am I really afraid of? And is it something that could be very valid? Absolutely. But how do I find the resources in place to actually help me make that sound decision? And so pretty much that's what rallied me around really getting the vaccine and being passionate about it, is because I had kids here before I even had my own daughter. And we care for all these kids every day. And so it's really just important for us to, really wrap our mind around that research and make those informed decisions that we can make a difference, not only in our personal lives, but also in the lives that we touch every day. And I think that's a powerful thing that we offer within our field and resources that we have available. So how do we apply that to our own lives?
Thanks for that, Allison. So I want to ask a question that was asked yesterday to Dr. Mezoff. And I know we had Dr. Claudia on, but it's asked all the time. And we have a lot of women on the phone. And I asked this to Dr. Later the other day, and she had a really simple and easy answer. So I'm going to ask Dr. Later the same question, because we probably have people today who maybe weren't on yesterday. We get over and over either posted on Focus or asked to Focus. If I'm pregnant or trying to get pregnant, what is the benefit of being the vaccine? And if it's not approved for children in the age of under 12 yet, how is it safe for a fetus? And I think you had a really great response to that. So.
Well, thank you. I appreciate that you liked the response. And I was listening in. Dr. Mezoff said the same thing yesterday, but I think I just used different words. Mm-hmm. When you get the vaccine itself into your own muscles, your body has to go through the work of making antibodies. So you get that vaccine, your body revs up, eventually getting to the IgGs. And then that is what you use to defend yourself. When children under the age of 12 are going to get this vaccine, the question is, what dose do we give them that's the most appropriate for them to rev up an immune response, and they can make their own antibodies themselves in a way that's safe and makes sense? The fetus doesn't have to do the hard work. And this is the cool part. The mom gets the shot in her own muscle, and her body and her immune system goes through the hard work of making the antibodies. Those antibodies, not the vaccine, the antibodies that mom made, travel through the placenta and into the baby's blood. So it's kind of like this passive, he didn't have to do anything, he just gets to enjoy the immunity itself without getting the vaccine in his own muscle. And that's the difference between kids getting the vaccine and a fetus getting the vaccine.
Thank you for that. I just thought that was such an important question, and I thought you had a really great response that was really, really simple. So thank you. Each of you talked about this, but you've got a lot of, again, women on the phone and probably people who join because they are worried, they are scared. So, and I'll do a round robin again. What advice would you give, these women who are worried and fearful? What advice can you give them? We'll start with Dr. Later.
That highly depends on what you're fearful about. And so the very first piece of advice I would give, which actually echoes what a lot of my panelists here with me are saying, and I'm so honored to be with these smart, awesome ladies. The advice is sit with yourself and figure out, what am I actually afraid of? Because I don't think that you're afraid of, I can sit here and spew statistics all the time. I think that the virus is dangerous. I think that not everybody who got the vaccine dropped dead. That the vaccine's not like a bullet in the head. You know this. But you're afraid of something real, or else you would have gotten the vaccine by now. Vaccines protect people, or you would have gotten it by now. Figure out what you're really afraid of so that we can address it. You're not crazy for being afraid, but we don't know how to address it if you don't identify what it is you're scared of.
Thanks for that, Dr. Later. Lindsay?
I totally agree with Dr. Later. The other thing that I would say is, don't be afraid to ask questions to myself, Dr. Later. I mean, anybody in this hospital, administration, they want to be here for you. They want to help you. We want to help you. There will be no judgment. You're welcome to reach out to us via email specifically. You don't have to feel like you have to even go through a different channel. I'm willing to listen. I'm totally open to all of your thoughts and concerns, or if you just want to be heard, I totally understand that as well. But ask questions, even if you feel like, oh, they're just judging me, or they have these preconceived notions. Like, we will listen and we will help you through that, and get you any information that you want, or just listen to you.
Thanks for that, Lindsay. Hillary?
I think, in addition to what they've already said, one thing to keep in mind is the motivation behind people that are telling you to get vaccinated or telling you that things are safe. If you look at the, ACOG and everyone that's come out with these statements that the vaccine is safe, and, the hospital is wanting us to get vaccinated because it's safe. And, they're not doing it because they just want us to do something else. They're doing it for a good reason. They're doing it to protect you, and they're doing it to protect all the kids here. So, they're not doing it just as something to do, but they want you to be safe. They want your family to be safe. And I think that's what all of the doctors and researchers and everyone that's putting out this information to say, like, this vaccine's important. It's going to make your life hopefully better, that, you don't end up with COVID and worry about those complications. But just look at what, keep in mind that those that are trying to get you to get the vaccine do mean the best for you, and they have your best interest in mind.
Thanks for that. Allison?
I'm going to echo off these ladies, but really just finding your resources, knowing that you have support throughout the whole facility. Again, I really push just making an informed decision based upon the research that is available. We have multiple avenues for that. We have a great library resource, so that can help pinpoint really some of those articles that you may be looking for. Is it fertility concerns? Is it something that's related to, autoimmune disorders or whatever that may be for you? And really finding the research to actually support your decision. I think the other important piece is just knowing that we are a family here at Dayton Children's, and I believe that since I walked in the door, that has not changed. And so knowing that you have a wealth of resources that you can go to actually help you make those decisions. Like I said, it took a while. I've talked to Dr. Altair. I went to people that I knew on the floors. And so really knowing that you have that mentor support and really reaching into your resources, and we can help get those answers for you.
Thanks for that, Allison. And I do want to say that following yesterday, I was really impressed that a nurse who was on the call reached out to Dr. Mezoff directly. And even though he's the chief medical officer, he's really open and he will respond. And I'm going to say on behalf of Dr. Alter and Dr. Kaladi, I mean, Dr. Alter's been here, I think, 42 years, as long as I've been alive. And so, the infectious disease team is really open to answering any questions to you, in addition to, of course, your manager and director.